Soluble mediators of the cutaneous immune system. Cytokines. Introduction. Cytokines is the soluble mediators of immune regulation. Its general features are pleiotropism and redundancy. Pleiotropism is the multiple biologic activities. Redundancy is the overlapping effects. Chemokines is the direct cell migration with broader roles in pathology. Their therapeutic uses include recombinant cytokines, inhibitory monoclonal antibodies, fusion proteins, topical immunomodulators, CCR5 analogs, and cytokine toxins. Concept of soluble mediators. Communication beyond one cell diameter requires soluble factors. This factor's transient release under infection or injury conditions. Their functions are recruit WBCs to site of injury. Guide T or B cells to lymph nodes. Antibodies produced by B cells. And effector T cell release into circulation. This response must be strong enough to eliminate pathogens and must be transient enough to avoid tissue damage. Definition of cytokines is the soluble polypeptide mediators that regulate hematopoietic and immune cell function. By influencing the differentiation, growth, activation, and migration of lymphocytes, it plays a role in immune development, homeostasis under basal conditions, and amplified during infection or injury. Clinical use in immune-mediated diseases. Therapeutic strategies are recombinant cytokines, antibodies and fusion proteins antagonists, topical immunomodulators, for example, imiquimod, CCR5 analogs in HIV therapy, and cytokine fusion toxins. General features of cytokines are pleiotropism and redundancy. One cytokine can act on multiple cell types and trigger different biological responses is the pleiotropism. Multiple cytokines can produce similar effects is redundancy. Example: several cytokines can induce T cell proliferation. Before the advent of a systematic nomenclature for cytokines, most newly identified cytokines were named according to the biologic assay. For example, IL-2 was previously called T-cell growth factor. Classifications of cytokines: IL-1, Illinois-2 and interferons is the first cytokines described had distinct and easily recognizable biological activities. Later it expanded with genomic discoveries into large diverse family. T-cell subsets exhibit distinctive patterns of cytokine production. IFN-gamma, lymphotoxin alpha produced by Th1 and promotes cell-mediated immunity. IL-4, IL-5 and IL-13 produced by Th2 are involved in allergy parasite defense. IL-17, IL-21 and IL-22 are produced by Th17 and involved in inflammation autoimmunity. Treg produce TGF-beta, Illinois-10 and involved in suppressive tolerance. Follicular helper T cells produce IL-21 specialized in providing B cell help in germinal centers. Th9 cells distinguished by high levels of IL-9 production that function in anti-parasite and anti-melanoma immunity. Th22 cells associated with skin inflammation that produce IL-22. This picture shows cytokines is the key factors in influencing the differentiation of naive T cells into various subsets. With the development of CD4 helper T cell subset cytokines. IL-12 is the key Th1 promoting factor, Illinois-4 is required for Th2 differentiation, and IL-6, IL-23 and TGF-beta are involved in promoting Th17 development. Structural classification of cytokines. According to 3D folding and receptor interactions. 4-helix bundle. Trimers with jelly roll beta sheet motif and structural organization dimers or trimers. Cytokines can be classified into IL-1 receptor family, TNF receptor family, hematopoietin receptor family, class 1 receptors, IFN and IL-10 receptor family, class 2 receptors, TGF receptor family, immunoglobulin superfamily, IL-1 receptor family. IL-1 receptor family includes IL-1 alpha and 1 beta, IL-18. Sharing NF-kappa B signal transduction pathway. Activation via TNF receptor associated factor 6. Any injury to skin may release IL-1 and initiate inflammatory response. Their activation and subsequent cytokine production will amplify the inflammatory response. This has been proposed as the basis of the clinical observation of inflammation in response to trauma, known as the Koebner reaction. Anakinra, IL-1 receptor antagonist, a therapy for adult rheumatoid arthritis and gout. TNF receptor family. Transducing via NF-kappa B activation involving TRAF2 and TRAF5. Apoptosis induction via death domain proteins. TNF-alpha blockade infliximab, adalimumab and etanercept, TNF receptor Fc fusion protein, proven efficacy in plaque psoriasis. They inhibit Th17 cells, latent tuberculosis, malignancy, CV risks should be monitored. IL-17 family. IL-17A and F, IL-17B, C, D, IL-17E also known as IL-25 are sharing common signal transduction, NF-kappa B activation via ACT1 and TRAF. The immune defense is against extracellular bacteria and fungi. Secukinumab, ixekizumab, anti-IL-17A, show superior efficacy to etanercept in treatment of plaque psoriasis. Class I receptors family. The largest of the cytokine receptor families. Signal transduction is via activation of JAK-STAT pathway. 5 shared receptor subunits have been described to date. They are 1. IL-2, IL-4, IL-7, IL-9, IL-13, IL-15, and IL-21 receptors sharing common gamma-C chain. 2. IL-2 and IL-15, IL-4 and 13, IL-9 and 21, IL-7 and TSL. Sharing common beta chain. 3. IL-3, IL-5, and GM-CSF sharing IL-3 receptor beta chain. 4. IL-12, IL-23, IL-27, and IL-35 IL-12 receptor beta-2 chain. 5. GP130 receptor members are IL-6, IL-11, IL-27, leukemia inhibitory factor, oncostatin M, ciliary neurotrophic factor, and cardiotrophin-1, IL-11 and 31. Clinical relevance. IL-12 is produced mainly by antigen-presenting cells. It regulates Th1 and Th17 responses. IL-12 and IL-23 blockade ustekinumab proven use in anti-psoriasis therapy. IL-23 specific therapy undergoes clinical trials. Other GP130 family are IL-11 and IL-31. IL-11 decrease inflammatory cytokines and increased platelets used in treatment of chemotherapy-induced thrombocytopenia. IL-31 contributes to itchiness in atopic dermatitis. Class II cytokine receptors include IFN receptors, IL-10R, and IL-20 family receptors. Common feature is signal via JAK-STAT pathway. Novel interleukin-10 related cytokines are interleukins 19, 20, 22, 24, and 26. IL-22 promotes keratinocyte proliferation and epidermal acanthosis. IL-26 has structural properties uniquely reminiscent of antimicrobial peptides. The cationic and amphipathic nature of IL-26 allows it to kill select gram-negative bacteria, including Pseudomonas aeruginosa, Klebsiella pneumoniae, and Escherichia coli, as well as gram-positive Staph aureus. Interferons, IFNs type 1 involved in antiviral MHC-1/NK activation. Type 2 IFN gamma produced by Th1/NK, CD8 plus T cells enhances antigen presentation, macrophage activation. Type 3 IFN lambda, IL-28 IL-29 similar to type 1 but less potent. IFNs in therapy. IFN alpha can be used in cancer and viral infections such as HPV, leukemia, and skin cancers. Topical TLR7 agonists, imiquimod and risaquimod induce type 1 IFN use to treat warts and BCC. TGF-beta family. TGF-beta 1-3. BMPS. And activins. Signal via SMAD proteins and involved in transcription regulation. TGF-beta. Play role in immunoregulation via Tregs and DC development. It promotes fibrosis, increased collagen, decreased MMPs. Plays a role in scleroderma and tissue remodeling. Tofacitinib. An oral JAK inhibitor. in developing to a viable therapeutic option for psoriasis, Phase 2, alopecia areata and dermatomyositis. Cytokines that signaling through the JAK-STAT pathway is a major component in cutaneous inflammatory disorder. Apremilast, inhibitor of phosphodiesterase 4 used in treatment of moderate to severe plaque psoriasis and PSA, Phase 3 trials. Action as reduction of TNF-alpha, IL-2, 12 and 23 and chemokine ligands 9, CXCL9, and 10, CXCL10. Summary: cytokines is the soluble mediators of immune regulation. Classified by their functions, the T-cell subsets that secrete them, or by their structural motifs. Crucial in host defense, immune homeostasis, and disease pathogenesis. Therapeutic applications are expanding rapidly.